Finally, about Obamacare. Let me tell you from a member of Congress's point of view, something you should consider. All of us are federal employees, and we get a subsidy for our health care premiums like every other federal employee. It's not a unique deal to the Congress. If you're a member of the federal government, you get up to 72% of your premium subsidized. Other employers do that, but it's a darn good deal. It's available to all federal employees. Now, Senator Grassley, again, I want to compliment Senator Grassley, says if we're going to have Obamacare, we ought to be in it, we, the Congress, and our staffs. Well, now, under the law that was passed, I think Senator Grassley was the originator of this idea, members of Congress and our staffs have to go into the exchanges. But we have the ability to go into the D.C. exchange, the District of Columbia exchange. And the law is written such, and every member of Congress who takes the subsidy is entitled to do it. I don't blame you one bit. You have to go into the exchange, and your premiums are going to go up, but the subsidy will continue. Senator Vitter believes, and so do I, that because we're leaders, we should take the road less traveled and experience more pain than those who follow. So I've been of the opinion that if you're going to change this law, that the Congress should not only go into the exchange, we shouldn't get a subsidy any longer. Why? Because most Americans are going to lose their employer-sponsored health care as it exists today. Maybe not in total, but your premiums are going to go up dramatically because your employer cannot afford to pay the increased premium under the old system. So you're either going to lose employer-sponsored health care and become an individual, or you're going to have to pay more because your employer's in a bind. They can't afford the subsidies that once exist because premiums for employers like individuals are going to go through the roof. And I just want to give you an example about what I've chosen to do. I've chosen not to go into the D.C. exchange, but to enroll in South Carolina because that's where I live. Now, enrolling in the South Carolina exchange, I won't get a subsidy. That was my choice. I accept that choice. Why am I doing this? To try to give by example what I think is coming to a lot of Americans in some form or another. So here's what happens with me. Under the old system, I was paying $186 a month. If I went into the D.C. exchange, my premiums would go up, but not great, not a huge amount. But now that I'm enrolling as a 58-year-old short white guy in South Carolina, my premiums are based on the county I live in and my age with no subsidy because I make too much money to get a subsidy. And people at my income level, we don't deserve a subsidy because it'd bankrupt the nation more than we're already doing if you did that. So under Obamacare in South Carolina, and I chose the bronze plan. Why? It's the cheapest one I could find. You know, I'm not independently wealthy. I make a very good living as a member of the Senate, $170,000, almost $180,000. But at the end of the day, here's what's coming my way. My premium goes up to $572 a month from $186. That's $400 a month, almost 200% increase. Under my old health plan, if I went to the doctor, I paid $20 copay. Under the new bronze plan, I pay $50. Under the old plan, if I saw a specialist, it was $30. Under the new plan, it's $100. My old deductible was $350 a year. My new deductible is $6,350. A $6,000 increase. My old plan had a $5,000 out-of-pocket limit. The new one is $6,350. And you also get rated not just on your age, but where you live. I'm paying $70 a month more than a county that's 40 miles away. The bottom line is, I'm experiencing, a lot of other people are going to experience. I'm paying a lot more for a lot less. Now, how can that be? When you're told that you get more and you pay less, and a politician tells you that, you ought to be very leery. That doesn't work out a lot in my life. You're going to get a lot more, but you're going to pay less. The reason that these premiums are going up is that all the uninsured, and I want to provide coverage to the uninsured as much as anybody else, they get insurance coverage with a subsidy. Well, who's paying those subsidies? The rest of us. So you're going to see next year employers have to back out employer-sponsored health care, either in total or in part. And what you're going to find throughout this country is that people who had employer-sponsored health care, just like the individual markets, their premiums are going to skyrocket. Maybe not as much as mine, maybe not 200%. The deductibles are going to go up, maybe not as much as mine of $6,000. But everybody in the country doesn't make $176,000. So all I can tell you, every member of Congress should look at what would your life be like if you didn't have a federal government subsidy, you didn't roll into the D.C. exchange, you went back home, and you had to pick a plan like everybody else in your state. You ought to sit down and look at what your individual life would be like. And if just look, you'll be shocked. I sure was. And this is really not about me, even though I'm giving you an example about myself. It's about an idea called Obamacare that's going to destroy health care as we know it in the name of saving it and making it better. I think we all agree we need to reform health care, but I think most Americans believe that their old health care system was working pretty good for them, but it could always be made better. So I'll turn this over to Senator Grassley, but I would love to see, Senator Sanders, I'm sorry, I would ask every member of Congress, whether you go into your state exchange, if one exists or not, do the math. You're going to be shocked at how it would affect you. And let me tell you, it's going to affect people you represent in similar fashion. So what do? Why don't we just try to sit down and start over and see if we can do better before it's too late? With that, I'll yield the floor.